And occasionally, actually quite often, we have dogs come in that have ear problems. And if your dog is shaking his head, scratching at his ear, rubbing his face along the ground, things like that, you might want to just take a peek into the inner ear flap and look and see if there's redness, debris, or anything that looks abnormal to you. And it's always a good idea to actually do that at least once a week, look in your dog's ears, because occasionally you may pick up and see that there might be a growth or some type of drainage, and some dogs are pretty stoic and they don't even show symptoms. So if you do notice that your dog does have a problem with redness, scratching a lot, the things that I mentioned, it is a good idea to take it to your veterinarian to have the doctor check, and the doctor will evaluate the ears, and oftentimes they will take a swab, gently take a swab inside the ear, get some of that debris, roll it out onto a slide, stain it, look under the microscope to see if there's any types of bacteria. Oftentimes we see bacteria, and actually even more often we see yeast, which if you have a good nose and you can sniff in there, a lot of times you can smell that things don't quite smell normal. It's a yeasty smell. And from that point, what we would do is oftentimes we'll clean the ears, gently clean the ears, and I'm going to show you how to do that today, but only with your doctor's recommendations. There are medications that if you go to the doctor, we may not clean the ears, and we may just put an ointment type of medication in the ears to help soothe. It's an antibacterial, antifungal, to calm those ears down. And we will have you bring the pet back in 2 weeks to check and make sure that everything is good. And we'll recheck a swab to make sure that all those little yeast buds and bacteria are gone. But what I'm going to show you today is that sometimes we'll have people do some maintenance cleaning at home to help prevent some of these problems. So I'm going to show you how we do that. We'll have, this is actually Tris Ultra Keto. It's a cleansing, antifungal, antibacterial. We do not use Q-tips or swabs in the ears, just like they tell you not to put your elbow in your ear. We don't put Q-tips in our dog's ears. So we'll take a cotton ball and saturate it. Some cotton balls are bigger than others, and some ears are bigger than others. So we're just going to moisten the cotton ball and open up the ear canal gently. And sometimes you may even have to kind of desensitize a little bit. Some dogs are a little bit more sensitive about their ears than other dogs. Gently put the swab into the ear and just gently massage that ear. And Misty is really good about this. And that actually, the solution works down into the ear canal and helps to disinfect that, kill any bacteria that may be down in there. And this just kind of gently swab the pin or the flap of the ear. And I guess Misty does have a little bit of debris in here. So there's a little bit of material on that cotton swab, so I am going to take that and do that again. Just put a little solution onto the cotton ball and gently put that into the ear canal and just gently massage that. Some dogs really actually like this. And then we're going to take that out, and you may actually even notice a kind of squishy little noise in there. Some of the solution down in the ear canal. After that, we're going to take a dry cotton ball, and depending on the size of your dog in the canal, we'll just lift that flap up, put the dry cotton ball into the ear canal, and then just gently massage that, and the cotton will wick up that solution and help to dry that out. Now, if your doctor recommends that, if your doctor is recommending an ointment or a medication for the ears, and also having you clean ears at home with a specific solution, when you clean the ears, you should wait about 30 to 45 minutes and let that ear canal dry out before you put the medication in. And you can see Misty is a very good little dog. And then just kind of gently swab that. And that's how we clean it. And we're going to do a little bit of up-close cleaning here. As we noticed on the left ear, there was a little bit of debris in there, so we are going to go ahead now and clean the other ear. Misty is being a very good girl. And again, I had saturated this cotton ball with some solution, and we're going to just gently lift the ear, put this into the canal, and just gently massage that ear. Get some of that solution down into the ear canal. And we'll see if this one comes out like the other one. So you can see she does have a little bit of debris in this ear. I'm going to actually gently swab the rest of the pinna or the ear flap here. And so you can see that there was debris there. I'm going to do another cotton ball since we got that out. Up here. It's okay, Misty, you're a good girl. So we're just going to gently put another cotton ball into the ear. You can see Misty actually has a little tattoo here, an identification tattoo. You're a good girl. So we're going to take that out. And it's a good thing we cleaned her ears today. So, since we still got some material there, I am going to do one more little cotton ball. Once that the cotton ball comes out clean, you can stop cleaning and then put a dry cotton ball in there and absorb a little bit of that solution. And you can see that Misty really doesn't seem to mind this.